morning, everybody. And I welcome, on behalf of the NESON, myself and Dr. Suraj Thulung, welcome all the participants to this continuous academic program of the NESON. And although I'm enjoying this virtual meeting very much, but there are friends who are telling that this virtual meeting is of not beneficial, in the sense they want, if the direct face-to-face meeting is good for gossiping and interactions and the gesture reviewing, which we don't get the opportunity in this virtual meeting. But to me, this is very good program, and during this
Pawan sir and Dr. Suraj, Dr. Amit, coordinator of the whole nation webinar series, and all the seniors and participants, good evening once again. Well, today I'm going to talk on this contemporary topic, COVID pandemic, very briefly. So far, many of us, probably all of us, have collected many information about corona and this COVID pandemic, and many of us have already known many facts about this typical health problem that is creating global problem at the moment. So I don't need to explain, or I don't need to present something very special here. Today, on the basis of some information and data I have collected, I have tried to analyze how this COVID pandemic is going on around the world, and in our part of the world, and in Nepal. And in this presentation, I will not be talking about any clinical part or any other part about coronavirus. So basically, some data and statistics and COVID pandemic pattern that is going on around the world. These are the source of information that I collected from, and so I would like to acknowledge this. The main sources are WHO report, John Hopkins University report, Center for Disease Control (CDC), Ministry of Health and Population, Nepal government, and others like PubMed, Medscape, New England Journal of Medicine, and Our World in Data. These are the objectives. Well, I don't want to go through this in detail, just to save time. And to start with, this is the corona map of the world. As you can see, actually this used to be a very beautiful map, but because of all these dots and bubbles, you can see यो संसारको म्यापमा खटिरहेको जस्तो भएको छ. Probably कोरोनाको खटिरा पनि होला. It looks so ugly now, and hopefully this map will become very beautiful again very soon in near future. So basically, the pandemic has largely affected Europe and America from the right beginning after China. And then the newer epicenters are South Asia, which is our part of the world, and this Latin America and part of the South America. And you can see in this screen, this part is the Pacific Ocean, and this part of the world, it is called Western Pacific region. It includes partly Japan, some small islands, Papua New Guinea, Australia, New Zealand. These are the countries in this region. And it is said that this part of the world is least affected and probably the best controlled regarding this COVID pandemic. Whereas some of the regions like this part of the world, you can see this is Mediterranean Sea, and this part of the world is called Eastern Mediterranean, and some countries here like part of the Italy, Greece, and then Egypt, Libya. These are the countries which is having many more cases every day, and this is also one of the newer epicenters of COVID. So at the moment, the main contributors to this COVID pandemic are USA, Latin America, South Asia, and Europe. Where proportionately, USA has more than 1/4 of total cases of COVID at the moment in the world. And then comes Brazil, occupying 30% of the whole caseload. Then Russia, India has 5% of the cases, and this UK, Spain, Peru, Chile, Italy, Iran, and others. So these are the main countries which are having maximum number of cases every day. This is a very beautiful picture, this graph produced by WHO. This graph basically shows the magnitude of the cases according to various regions. Like this one, orange one, it is America, including both North and South America. This light green one is Europe, and this green one is Eastern Mediterranean. Blue one is South Asia. The light blue one is Africa, and the small thin red line you can see here, it is Western Pacific region. So in the beginning, America and Europe had maximum number of cases. Now Europe seems to be much better, only small number of cases occurring every day, and life is almost towards the normal, back to normal. Whereas in case of America, as you can see, there are many more cases coming up. Similarly, the situation in case of South Asia and these Eastern Mediterranean countries. Similarly, the situation in Africa, but the magnitude is much less than in Asia, South Asia or other countries. So altogether, around 50% of cases are in Americas, including North and South America. More than 1/4 of cases are in Europe and other part of the countries like Eastern Mediterranean, Southeast Asia, Africa, and Western Pacific countries. These are the main contributors at the moment with daily, everyday cases. USA is still having highest number of cases, more than 40,000 every day. Similarly, Brazil is having more than 35,000 every day, even though these figures are up and down, but these are the average figures. Similarly, India more than 18,000 every day, Russia 6,000, South Africa, Saudi Arabia. South Africa is coming up significantly. It's coming up in the list. Saudi Arabia, similarly Chile, Pakistan, Peru, Mexico, and Bangladesh. So South Asian countries, you can see out of these 10 cases, there are 3 South Asian countries, signifying that South Asia is also currently a highly vulnerable zone regarding this COVID pandemic. Having said that, so many cases have been affected by this COVID-19. More than 193 countries have been affected. There are still few countries which have not reported any COVID cases so far. Maybe really because they don't have any case of COVID, or maybe because of some other reason, maybe political reason, they have not reported. I don't know exactly. So among them are North Korea, which has not reported any case of COVID so far. Similarly, Turkmenistan. Turkmenistan is a country nearby, just towards the north of Iran and Afghanistan. This is a part of previous USSR. Now Turkmenistan, no single case has been reported from Turkmenistan. Similarly, there are so many other islands, like small islands in Pacific Ocean, like Solomon Islands, Vanuatu, Micronesia, Tonga, this Marshall Island, Palau, and Tuvalu. And now these are small islands nearby Indonesia in the Pacific Ocean with population maybe 5,000 or 10,000. These are the countries or islands, independent countries, which don't have any COVID so far. Similarly, these are the countries with no deaths so far. They have many cases of COVID-19, but so far they don't have any case. Like Namibia, it's an African country. Similarly, Mongolia, being in between Russia and China, supposed to have a high number of cases of COVID, but still Mongolia is one of the best controlled. Like similar in the Vietnam, they have very few cases of COVID cases and no deaths so far. Similarly, Uganda and Eritrea, another African countries, Cambodia, Southeast Asian countries, no deaths so far. Bhutan is South Asian countries least affected and best controlled, now having hardly 75 cases so far. Cases of COVID. Similarly, Laos, another country, this is small, they also don't have any deaths so far, and Papua New Guinea. These are the countries without any death because of COVID-19 so far. Here are the list of some of the events in the chronological order. On 31st, 2019, first case of corona was reported from China, Wuhan, China, reported to WHO. Then exactly 15 days after that, the first case was identified in Nepal. He was Mr. Bikram Singh, student from Wuhan. He was the first case of that was isolated in Nepal, and that was reported. Then on 30th January, CDC confirmed the first case in NIS, and WHO had global public health emergency on 30th January. Similarly, on 23rd January, Wuhan lockdown was started, and nearby other cities were also quarantined. And it is said that more than 18 million people were placed in isolation that time, and it is possibly one of the highest number of isolation and quarantine in the history of world because of this any pandemic. So for that commitment of China, WHO praised China, and since then USA or Trump got annoyed with WHO and China, and this was all the politics going on since then. And then on 31st January 2020, United States declared coronavirus a public health emergency. Then on 11 February 2020, the disease was named as COVID-19 and the virus SARS-CoV-2 by WHO. And finally, on 12 February, WHO declared pandemic. And then lockdown started in Nepal on 24th March till 15th June. It was more than 80 days. Okay, now talking about one of the conveyances. Conveyance means means of transportation like a huge cruise ship, and this is one of them. There were two actually. So this is one of them, the very big, huge cruise ship named Diamond Princess. This was the first cruise ship that was quarantined on 4th February 2020 in Yokohama, Japan. That time it had 3,711 passengers and more than 100 crew members, and 700 people were infected and 14 people died in that cruise. And most of the passengers at that time, most of the people who were infected were asymptomatic at that time. Let's talk a little bit about epidemic curve. This is a simple example of epidemic curve. Epidemic curve is usually like this. This is the rising part. This is also called exponential phase or acceleration phase. If there is no mitigation process, no control measures, then the epidemic curve comes down like this. In between, they can have another phase called plateau phase, and usually goes down and finally it becomes zero. So this typical curve shows that most of the time, this deceleration or declining phase is much longer than this exponential phase in any pandemic. But once there is adequate mitigation, once there is adequate healthcare services, then slowly this healthcare goes up, and slowly this pandemic curve comes like this with less number of cases and less severity of the pandemic. So when there is adequate mitigation process, when there is adequate control measures, when there is adequate healthcare services, then the pandemic curve changes like this. But if there is poorly controlled epidemic, when there is inadequate mitigation, inadequate control measures, inadequate health services, then after declining phase, there can be another phase of the same epidemic, same again second acceleration, and again same type of pattern, and there is resurgence of the cases. So this is example of inadequate or poorly controlled epidemic. So coming to the different stages of epidemic, currently WHO has made its own newer classification of epidemic stages, which is much more complicated. But this is the one that I am going to explain is a simple one, and most likely all of us know about this stages of epidemic. First stage is initial stage, and in this stage there are only imported cases from epidemic areas. And at this stage, it's very easy to control the epidemic, as isolation is very simple, easy. Quarantine is very easy at this stage when only isolation of that particular case is enough, and when there is very few cases in this initial stage. So control has to be taken at this stage of epidemic. Similarly, stage 2 is the local transmission stage. There is already a source of infection there, and one infected person transmits others. And this is also the best stage of control. And at this stage, basically control is by tracing and tracking. So the epidemic control has to be done at this stage 1 and stage 2, and these are said to be a golden stage as far as epidemic control is concerned. Then comes stage 3. If not controlled, then the epidemic goes to stage 3. There is a community transmission, the stage of community transmission. Even though there is no known source of infection, even though there is no any other risk factor, the people turn out to be positive. For example, if there are cases in Kathmandu, if there is no non-infection in other parts like Jumla, Humla, or Manang, even though there is no risk factor, then the positive cases appear in those areas. Then it is called the community transmission or stage 3 transmission. And at this stage, the control of epidemic becomes very difficult because tracing and tracking cannot be, and isolation and quarantine becomes very, very difficult. And at this stage, the only thing that can be done is mass screening. This is what China has done. This is what Korea and other countries did, European countries did, and that's how they became successful to control the COVID pandemic. And this is the only option at this stage 3. This is the stage 4, the last stage. It is a full-blown epidemic stage, and at this stage, nothing can be done. And the only thing that we can do at this stage is just wait for immunity. And herd immunity is something which is very difficult to achieve. For this, at least more than 2/3 of the whole population need to be infected, and this is something which is beyond our imagination at the moment. Now, talking briefly about COVID pandemic in the world. So this is the current situation. Pandemic started, even though pandemic started in China much earlier. It started in Europe in about in February, late February or early March. Then pandemic started in America. This was the exponential stage phase. This is the exponential phase of this pandemic, in which the number of cases rise rapidly in many parts of the world. Then comes this plateau phase, which is expected. Then we are expecting something like deceleration or declining phase, but unfortunately there is no deceleration. Rather, there is now again second stage, second acceleration phase, and cases are growing up more rapidly. Many cases are appearing, and this is the second acceleration phase that is going on at the moment in the world, the epidemic of COVID at the moment. Similarly, this picture is a pattern of epidemic or pandemic in different parts of the world. This is America, North and South America. This is Europe. This is Eastern Mediterranean, and this is Southeast zone. This is Africa. You can see in America, after plateau phase, as I explained, cases are many more cases, newer cases are appearing, and we don't know when this second acceleration will go until when, and when will the second plateau will come, and when will the second declining phase will come. We don't know. It seems it is going to take much longer time in this part of the world. Whereas in case of Europe, you can see there is sudden rise in the cases, that is exponential phase. There was some plateau phase for some time. I think it was just for a few weeks. Then there is deceleration phase, and now there is some sort of second plateau phase with a minimal number of cases occurring every day. And this is probably the best example of the epidemic, usual pattern of epidemic. And this epidemic suggests that Europe has, to some extent, has become successful in controlling the epidemic. Whereas in our part of the world, as you can see in this picture, pandemic in our part of the world started somewhere here at the end of this March, and it's been quite long time, and we are still in this exponential phase. Number of cases are rising every day. Many more cases are appearing every day. We don't know when the peak we will reach in the peak of this epidemic. We don't know when the plateau phase will come, and we don't know when there will be declining phase. So it seems that in this part of the world, in our part of the world, the epidemic seems to be much slower, and it may be probably much longer, and our part of the world will suffer probably much more than others. Similarly, the situation in Eastern Mediterranean, but I think as you can see here, there is some sort of plateau or declining phase already there, and hopefully they will have this continuous deceleration instead of second rising phase. So again, this is about the world trend of the current pandemic. More than 10 million people have already been affected. This is the point where pandemic was declared by WHO. And again, this is exponential phase. So in the current epidemic, this exponential phase was about 3 weeks. Then plateau phase was about 2 months. And instead of declining phase, again, there is the second acceleration phase, which is already 3 weeks. And it seems it will become late. And this is the time when lockdown started. That was in 24th March, Nepal. And this second acceleration phase is most likely because of the more tests, more detection, and newer epicenters. And newer epicenters are, as I've already explained, South Asia, Latin America, and South America. These are the newer states in USA, like Texas, Florida. These are the newer epicenters, and because of this second acceleration phase is there in the COVID pandemic at present. Similarly, to the death was rising initially, and then there is slowly death was decreasing, number of deaths was decreasing. Again, at the moment, deaths are coming up, even though it is not as high as it was in the past, but again, still there are deaths. Probably this decrease in the number of deaths is because of more quarantine, more isolation, better ways of treatment, more intensive treatment, and more recovery. But again, because of this newer epicenters, number of deaths is again trying to go up. So again, talking about old trend, this is the pandemic. Then this is the lockdown that started in Nepal. And China pandemic started much earlier, in the early or mid-January. Then this is the time when Europe pandemic started. That was in late February and early March. And this is the pandemic in USA that started in the middle of the March. Then India pandemic started here in the early or late March or early April. Then pandemic started in Nepal. So in Nepal, I think nature was good enough to help Nepal to start this epidemic much later. This is almost 5 months from the epidemic in China and epidemic start of epidemic in Nepal. So this was quite a good time, long time. Probably we could have learned many things from this period, so that we could have better controlled pandemic in Nepal. But still, we are having a difficult time. I think will be having difficult time in the future. So let's try to analyze pandemic in different parts of the world. This is the epidemic pattern in China. It started earliest in the world, that was in early January 2020. The pandemic curve is quite acute. There is acceleration and deceleration phase, as you can see here, except for this one spike. And the exponential phase was only 2 weeks. Within 2 weeks time, it went to the deceleration phase. There was no plateau phase in between, or maybe it was very short. And then deceleration phase was around 2 to 3 weeks, and about 1 month or so, the pandemic seems to be well controlled. And even though few cases are being identified, being reported these days, it's almost within control at the moment, and life is back to near normal at the moment in China. So this epidemic in China is an example of best control of epidemic, with very short acceleration phase, very short and immediate deceleration phase, and only very few cases afterwards. This is one of the best example of epidemic control. Similarly, this is the pandemic in Europe. This was the point where China pandemic was started, early January. And in Europe, it started almost 2 months after that in China. It was in late February 2020. Acceleration phase is about 1 month, which was about 2 weeks in case of China. Then with 2 weeks of our plateau phase, then it went to deceleration phase. And this deceleration phase is now almost more than 3 months. So as I already explained, in case of epidemic, usually most of the time this deceleration phase or decline phase is much longer than the acceleration or exponential phase. And well, since it is already a deceleration phase in Europe and life is almost towards the near normal, and this is also a very good example of epidemic control. A typical epidemic, this is example of typical epidemic curve with some mitigation, some control, and this is a good control in fact as compared to other countries at the moment. This is pandemic pattern in USA. This is the time when the China pandemic started. In USA also, this exponential phase was about 1 month, same like in European countries. But this pandemic phase was a bit longer, which was only 2 weeks in case of Europe, but it is almost 1.5 months, 1.5 months in case of USA. Then there appeared some deceleration. Everybody was hopeful. America started going back to normal life. Lockdown was lifted. It was for about 1 month. Then again, we can see there's a newer spike coming on. And this is at the moment is the highest number of cases appearing every day, more than 40,000 cases every day. This is the second acceleration phase, and nobody knows how long it will go. When will be the plateau or declining phase in USA? It says that USA is going to have very difficult time in future. And this phase, this pandemic pattern is an example of poorly controlled epidemic. There is a mitigation process, there is a control measures, but despite having all those efforts, this is the example of poorly controlled epidemic without enough or without adequate mitigation and control. Well, now it's South Asian perspective that where I'm going to talk about. The ranking on the basis of total number of cases, India in the first and fourth in the world, and of course, followed by Pakistan, Bangladesh, Afghanistan. Nepal is in the 5th position, and these countries, Maldives, Sri Lanka, and Bhutan, they seem to be in very good state of COVID control at the moment, and Bhutan is the best one so far. And in fact, the first case was detected earlier than the first case, but since then, very few cases in Bhutan so far, less than 75 cases with 0 death. Nepal seems to be highly vulnerable with very high incidence. This is going on. mainly because of the cross-border movement of the people from India to Nepal and Nepal to India, and because of very poor healthcare system, poor public awareness, poor resources, it seems that Nepal is going to be have difficult time with this COVID pandemic. Again, talking about South Asia. So this is the time when pandemic started in South Asia. That was around the end of March. So again, there was enough time. There was almost 3 months gap between the epidemic start in China and almost 2 months after the pandemic was declared. So this time was actually a golden time. This time was the time when we should have learned many things regarding pandemic and its control. So it's been already more than 3 months that acceleration phase is going on in this part of the world. And we don't know, decline phase or deceleration phase will be very late. It cannot be expected now very soon. It seems it will be very slow and it will be prolonged. This is just example of India. Regarding South Asia, I am going to give some examples of India because scenario in Nepal is very much similar to that of India, and many things are almost like a reflection of India, and data collection is much easier than that of Nepal. So I have in many instances I have given the examples of India. I have quoted data of India. So the pattern of this pandemic in India is like this. It's very similar to that of South Asia, because India almost represents South Asia. Almost more than 3 months of exponential phase, and it's still going on. And currently India is also having tough time, having more than or almost 18,000 or 20,000 cases every day. Regarding few facts about India, which is related to COVID pandemic, India is the second most populous country, as everybody knows. And India has one of the highest this population density in the world, that is about 420 per kilometer square of area, whereas that of Nepal and China is much less as compared to that of India. And socio-economically, even though India is going very fast regarding overall economic status, it belongs to lower mid-income countries according to World Bank. In South Asia, Afghanistan and Nepal belong to low-income countries, whereas Maldives, Sri Lanka, they belong to higher countries. So by this, what I mean to say is, pandemic hits harder in the low socio-economic countries. So most of the South Asian countries belong to this group, and we are going to have difficult time because of COVID pandemic. Other facts about India so far till date, till now, till the moment, India is in the 4th highest position according to the number of COVID-19. India is in the 3rd highest position according to the number of daily incidents, according to the number of daily incidents of COVID cases, and also according to the number of daily deaths. It is in the 3rd position in the world. It is in the 2nd highest position according to the number of serious or critical cases. And this case also matters because ultimately these are the ones who are going to die because of COVID pandemic. So India is in the highest position according to the number of serious and critical cases. And India is in the highest position according to critical case or active case ratio. So number of critical case out of this active case is very high in India. For example, in USA it is around 1.31%, in Brazil it is around 1.4%, whereas in India it is about 5%. That means there are 5 critical cases out of 100 active cases of COVID pandemic at the moment. So this suggests that our part of the world, that means South Asia, is highly vulnerable, not only in terms of COVID occurrence, but also in terms of death out of COVID-19. So now coming to Nepal, finally it's Nepal that I'm going to talk about. Well, again, this is the pandemic declared, and European pandemic started in late February, then American pandemic in the mid of the March, then Nepal lockdown started on the March 24. And this is the exponential phase in Nepal. It is almost 7 weeks, nearly 2 months, less than 2 months. And the time between Nepal lockdown and the time between start of pandemic in Nepal, it is about 2 months. And the time from the initial occurrence of the pandemic, that was pandemic in China, till the time starting point of pandemic in Nepal, it is almost about 5 months. So why I am talking about this is this 2 months time or 5 months time is a huge time. It's a golden period for epidemic control. This is the time when we should have learned many things about epidemic, pandemic, and measures to control the pandemic. So if we had adequate, homework to control epidemic in this period, probably it would not have happened at the moment. But as a result of our probably weakness, that we could not do probably most things in during this lockdown or before that. So this is the result of all these things. So actually, this was the golden period to control the pandemic. But fortunately, it seems that for last 2 weeks time, the number of cases occurring every day is getting less and less. So I don't know exactly, but let's be hopeful. Maybe Nepal is going towards the plateau phase, or maybe towards the declining phase. It's been already 2 weeks that our cases are occurring less. Yesterday it was, I think, 300 something in 24 hours, but according to today's data, it is more than 480 cases today. That means in last 24 hours. So still some spikes are coming on, but hopefully Nepal is entering declining phase of epidemic, but we don't know yet. So according to the latest news from Ministry of Population and Health, government of Nepal, they say that more than 94% of cases in Nepal are imported cases. So it is a good news in the sense that now people coming to Nepal from different parts of the world is getting less. Number of people coming crossing the border is getting less. So this is, in that sense, I think this is a good percentage. That also suggests that we have very minimal local transmission, or probably no community transmission. And government of Nepal says that Nepal is still in stage 2 of epidemic. That is in the local transmission stage, not the community transmission stage. So this is also a good news, but we don't know exactly, because almost all the districts of Nepal have been affected by COVID pandemic. That suggests maybe Nepal is already in the stage 3. But Nepal government, just a few days back, there was one webinar, and Dr. Jageshwar Gautam, who is currently spokesman of Ministry of People and Population and Health of Nepal government, he said that Nepal is stage 2. This is about pandemic in Nepal. This is the picture issued by Nepal government on 27th June. This sign is there, that means 0 case. So you can see all the districts have been affected. There's not a single district without any COVID cases. Just one day before, that was on 26th June, this district, that is Raswa was the only one that was left till 26th. On 27, that was the latest district which was affected, which reported COVID pandemic cases. There was 10 or 11 cases, and they said that all the cases were imported cases. So till that time, these were the most affected districts. Rautahat, which is in the province number 2. Similarly, Kapilvastu in the province number 5. Sarlahi and Mohattari again in province number 2. These are the 4 most affected districts so far in Nepal by COVID pandemic. This is on the 28th June, after all the districts were affected by COVID pandemic. Then immediately on the next day, on the second day, these greens are the districts which became COVID-free, corona-free. So these are the Solukhumbu and Sankhwasabha, Solukhumbu, Bhojpur, and Kavre-Palanchok. So on 20th June, these 4 districts became COVID-free. But every time, data is changing, scenario is changing. So again, next day on 29th June, out of these 4 districts, this Kavre-Palanchok again reported one case. So again, it was affected, whereas other 3 districts remained unaffected. Then again on the next day, 30th June, now the Solukhumbu and Bhojpur, Sansaba was also affected again, and these 2 districts remained the COVID-free districts on 30th June. Similarly, this scenario of Nepal is changing, but the daily number of cases is not as much as that was around 2 weeks back. So it's a good thing that total number of cases occurring every day is getting less. So this is the latest data by Nepal government. This figure shows 91% male and 9% female in total discharged cases. In this positive cases, 88% cases are male and 12% are female. So like that around the world, in Nepal also, most of the cases are male patients. And this graph, this bar diagram shows province number 2 has the highest number of cases so far, more than 5,000. And this green bar is number of cases that is already discharged, and these are still active cases. Similarly, province number 5, they still have many more cases of active COVID-19, and many cases have been already discharged. And in this table, you can see this Sakriya case, that means active cases. This is most numerous in province number 5, more than 3,000 cases, whereas in province number 2, there are about 2,400 cases, active cases. Similarly, other data, total PCR rate is, this PCR positive rate. That means out of 100 PCR tests, 5.94%, 5.94 cases are turning positive. Discharge rate is around 23.55 cases out of total positive cases. And this death rate in Nepal is around 0.21. Whereas in the world, as you know, the highest death rate is around 15-16% in Belgium and even in UK. In India, I think it is around 3 to 4%. In Nepal, it is around 0.21%. This is the proportion of positive cases in different parts of the Nepal, different provinces. This is the province number 2 with 34% of cases. This is province number 5 with 27%. Altogether, around 2/3 of cases in province number and province 5. Other cases are have less cases, and province number 3. This is our province. I mean, where we currently are living in. Kathmandu and Bagmati is in this province. So this province has probably the least number of positive cases, and second least number is in the province number 1, that is Biratnagar area. In the Bagmati province also, the most numerous cases are in Dhading district. So Dhading has most numerous cases, followed by Chittagong, then Kathmandu. So Kathmandu stands in the 3rd position as far as the number of cases are concerned in Bagmati province, that is province 3. This is another international scenario. This is the transmission per million population. This pink line is average line of the world. So many countries in Europe, they have gone to this plateau phase as far as transmission is concerned. And this country in this lower level, they are South Asian countries. For example, you can see this orange dots. This is India, and this white dot is Nepal. This Nepal is the rise is quite sharp. This trend is very sharp. You can see, and other countries like this red one is Bangladesh. This yellow one is Pakistan. So all the South Asian countries are having many more transmission per million population, and this is not a good sign for us. Similarly, COVID-19 fatalities compared to population. This is again the pink one is average. We can see South Asian countries are here. The figure, the graph is sharply rising with South Asian countries, whereas these European countries, they have already plateau phase with less number of deaths compared to population. This is another interesting chart showing relation of transmission to longevity, that is age. So this chart shows that with age, there is higher chance of infection. The recovery is slow with the age, and this is higher in the higher age. So old people are suffering much more than the younger ones. But in contrary, this is the chart, very interesting. Again, as you can see, this is the median age, and this is the number of fatalities, and this is a comparison of fatality with median age of people who are infected. So the countries here, this is the group of people in the old age. So here you can see there are European countries. European countries have more older people dying out of this COVID, whereas in this group you can see there are African countries, and in this country old people are quite safe and more younger people are dying, whereas South Asia is somewhere here, India, this Pakistan, probably Nepal is also somewhere here. And in our part of the world, comparatively, the younger people are dying more, probably because in Europe and America, old people are more active socially, whereas in our part of the world, old people are less active. They are usually confined at home, and probably this is the best thing that we can do during this pandemic period. That's why old people are quite safe in Nepal and South Asia and Africa. Now let's talk a little bit about corona test. I am almost towards the end of this presentation. Regarding test per million population, USA has quite a good number of tests, more than 26,000. That's why many cases are being detected. Europe has even more tests. The highest number of tests are in Denmark, Russia, UK, and Spain. They have more than 1,10,000 per million population. Similarly, Nepal has around 13,000 tests, whereas India has much less tests. India has only 4,500 tests per million population. And Maldives and Bhutan seem to have good number of tests, probably because they have much less number of people, much population as compared to Nepal and India and other countries. This table in this table, I would like to show this column again, test per million population. In this table, you can see this is Afghanistan. Afghanistan has the least number of tests so far. And Afghanistan stands on the 8th rank in South Asia, whereas Maldives has the highest number that stands in the first position in South Asia as far as tests per million population is concerned. This chart is also very interesting. This is again daily test done every day, number wise. So India has the maximum number of tests being done every day, whereas other countries like New Zealand, South Korea, they have now much less number of cases now because they have already controlled epidemic. But India and Nepal, we are still having many cases. So India is doing good number of tests, but this is only according to the number. However, if we compare the number of tests per 1,000 million people, so it is it should be compared to the number of people exposed. So when we calculate test per 1,000 people, then India becomes, in not only India, Pakistan, Nepal, Bangladesh, all our South Asian countries, we are in quite a lower level, and Maldives has very good number of tests per 1,000 population. And I think Nepal is also in a higher position than other South Asian countries as far as this test per 1,000 million population is concerned. So this is also good news for Nepal. Similarly, test per 1,000 million people in other countries like New Zealand, United States, other European countries, they have much more tests, whereas these are the South Asian countries who have much less tests per 1,000 people. This is about test per new confirmed case. Actually, WHO has suggested, as you can see here, WHO has suggested that at least there must be 10 to 15 tests per case. If one new case has been identified, then we should perform at least 10 to 30 tests surrounding that particular positive case. In that sense, this is again South Asian countries, and there is South Korea as well for the comparison. In that sense, also Maldives is in quite high position. It has good number of cases per confirmed case. And Nepal is also quite, this purple blue color is Nepal. Nepal is in a higher position as compared to India, Pakistan, and Bangladesh. Again, stressing that Nepal has good number of tests performed so far to detect and diagnose the cases. So coming towards the conclusion, well, South Asia is currently a new epicenter of COVID. So Nepal, including other South Asian countries, are highly vulnerable at the moment. Of course, government has its own strategy and policy to control the epidemic, but it may not be that effective as compared to other developed countries. So in our context, I think self-protection is the best policy. And as far as these researchers, clinicians, and practitioners are concerned, we need to share the case information and our experience with our colleagues. We should continue investigation about COVID pandemic so that we learn more. And we should disseminate these proven facts with our medical colleagues, with the patients and their families, so that we can overcome the pandemic easily and sooner. So this is the time to endure. This is the time to be patient. As this lady, you can see, because of continuous use of mask and cap, she has already, these scars making her ugly. Otherwise, she was most likely very beautiful lady, but because of this, scars. And there is one saying in China, probably many of you have already heard it. So initially, when quarantine or lockdown was started in China, many people talked about human rights. So if there is quarantine or lockdown, then there is no human right, they say. But if there is no quarantine or no lockdown, there is no human left. So this is very interesting. And similarly, if there is quarantine and lockdown, I will see you again, we'll see you again. But if there is no quarantine or no lockdown, then we'll be in ICU. So this is the end of my presentation. Thank you very much.
Thank you, Prabin Dai, for enlightening us again on Corona. It was a nice presentation as always. You have 4 questions, Dai. First question from Dr. Bikram. He wants to know what is the epidemic curve of Nepal at the moment.
Well, I had shown it in my presentation. If you allow me, then I will share my these presentation slides once again. Probably यहाँ जानुपर्छ होला. So this is the epidemic curve of Nepal at the moment. You can see here. So this is the exponential phase. At the moment, we are somewhere here. So there was exponential phase of about 7 weeks. It was not that long.
It's audible, right? Please.
Noise. Anyway, this is the exponential phase in Nepal, and as compared to other parts of South Asia like India, this is much shorter. In India or South Asia, if you remember, it was almost 3 months in India. This is India, and this is South Asia. Exponential phase was 3 months, and it is still going on. Whereas in case of Nepal, well, it is too early to say, actually, too early to predict the things. But so far, this is the finding. In the exponential phase in Nepal is about 7 weeks, less than 2 months, and it seems maybe it's an early sign. For last 2 weeks, the number of daily cases is getting less and less. It went up to 600, 700 cases in a day, but now it is around 300, 400 cases in a day. So in that sense, now probably, I don't know exactly, let's hope, Nepal is going towards the declining phase of this COVID pandemic. So this is the pandemic curve of Nepal. Bikram, probably you understood this.
Yes, sir. You have another question from Professor Amit. He wants to know about, do you think mass screening would work in Nepal?
Yeah, but I don't know exactly. It is a very common question. These days, we come across to many such things that people have started, stopping doing this rapid test or even PCR. Many hospitals in Kathmandu, they were saying now they have stopped doing this thing, RDT or PCR. Because in Nepal it is not practicable, but ideally this is the one. As I already told you, if the epidemic goes to the third stage, that is community transmission stage, then mass screening by either RDT antibody test or PCR, whatever. This is the only means to detect the cases and to control the case. South Korea did. This is what China did. This is what European countries did. So ideally this is the one. Well, I don't know exactly where everything matters. The government is not so stable. Government is not. I don't think government is, working strongly to control this epidemic. So practically, it may not be possible in Nepal as a whole. But I think in Nepal, in Kathmandu, in bigger cities, in the hospitals, private or government hospitals, we do this screening as much as possible, if practical. That is what I think.
Yes, thanks. Another question from Professor Amit himself. What is the present distribution of active cases according to severity of disease? I think to some extent you have answered it.
Yeah. So you mean in Nepal or what?
In Nepal.
Nepal my active case got recently I saw the data issued by the government. So according to this, sorry.
I think province too, there are more cases like I think to some extent you have.
Just to you only province 2, there are maximum number of cases of altogether more than 5,000 cases, including those discharged and including those active cases. And province number 5 has the second highest number, more than 4,000. And province number 3, Bagmati, I think which one? This is the I think province number 3. This has the least number of cases among other provinces.
Actually, his question was, I think it will be a bit difficult to answer. His question was according to severity, mild, moderate, and severity, and asymptomatic cases.
I don't know. Well, actually, collecting data regarding Nepal is much more difficult than data of India or other developed countries, because government has not issued this data so far, I think. Well, I didn't have any access to the data. If you go through the website of Ministry of Public Health, hardly you can see these few pictures that I showed you. No other, like even I couldn't find what is the daily incidence rate, what is the difference between the occurrence every day, how much percent of the cases are mild or severe. But as far as I know, in Nepal, the number of critical cases or serious cases are 0. That's why the number of deaths is also much less in our country. Whereas the number of critical cases or deaths is very high, for highest in USA, more than 6,000, I think. And the second highest is in India, which is almost 9,000 out of total active cases. So in that sense, Nepal does not have critical cases, and probably almost all the cases are mild cases. That's why discharge rate is very high in Nepal. Probably I answered his question.
Yes, sir. Now you have last question. That is the Suresh, because he wants to know you wants to have your opinion as what is the opinion of reproductive rate of epidemic RO. Is it helpful in assessing the severity of pandemic in this?
Yeah, RO is also called R0. This is also called transmission rate. So for any epidemic to happen, the R0 or RO should be more than 1. So if it is more than 1, there will be sharp rise in the number of cases, and that is what is called epidemic or pandemic. So this is definitely helpful theoretically. In case of Nepal, we don't know exactly. Again, we don't have enough data. In the world currently, as far as I know, the R0 is around 2 or 2 point something. Probably in some places R0 is very high, as high as 4, and in some places R0 is low, less than 1. But on an average, it is high. That's why there is pandemic. So R0 is definitely helpful in assessing the transmission rate and assessing overall pandemic status. It is definitely helpful if we can calculate in Nepal's context as well. Definitely.
Thank you, Prabin, for answering those queries. I think Mohan sir would like to say something about. Mohan sir, please.
Yes. Thank you, Suraj. Prabin, I joined your later part of the presentation. Excellent coverage of the entire topic. Is very hard to compile all the data. Being the level 3 COVID as well, I'd like to add something to our colleagues. All the cases we have in Nepal, about 90 to 95% are totally asymptomatic. Only 5 to 10% are symptomatic. So by the true definition of active cases, we don't have that many active cases. So we cannot really compare our data with the data of the US, where they don't even admit the patient. They don't even do the test unless they are really symptomatic. Even for mild symptoms, initially they were not doing tests. Because a lot of my relatives also had symptoms, but they were not given the privilege of getting the test. So we have very few asymptomatic cases. Right now, we have 3 neurosurgery patients, COVID positive neurosurgery patient in our COVID EM block in teaching hospital. All 3 of them are asymptomatic in terms of COVID symptoms, and only one child underwent tracheostomy yesterday, and then for entirely other reason, and she was found to be positive, 45 days old. So the question, couple of hypotheses have regained, again, though it was talked about in February also. One is the MMR. Now suddenly people have had interest in MMR. Rubella vaccine somehow has a cross protective effect. Another was the BCG. These 2 were maybe somehow protective of the severe symptoms of COVID. Maybe they become positive, but they don't develop that much symptom. These are the 2 things. I just wanted to add what Prabin was already saying. So we have very few active cases, so they are not really comparable to the other reports from Europe or from America. That's it.
Thank you. Thank you, Mohan sir. I think if you have if any seniors want to have any input, like Pawan sir, Krishna sir, Yamdai. about today's seminar?
Yes, myself. Uh, Thank you, Praveen, for a very wonderful pictorial and the graphic presentation of the pandemic. And really, very impressive. And as Mohan said, really very good presentations. And we have reviewed our public health science with you and statistically too. And what I would like to just add over here, and that we are focusing very much on the COVID. But if there is a comparative chart which we can produce, which many of the institution has already presented, that how many deaths are there from the other diseases, how many deaths are from the other virus infections, or we call it a viral fever or whatever it is. So that can give a real picture, okay, where do we stand. Otherwise, if we go with the social media, if we go with the news, everywhere, everybody is talking about the COVID, and as if it has completely changed our life. That is the presentations. But there are other diseases equally more important, and other viral infections are also causing a lot of the damage, but it is not being projected rightly as it should. And otherwise, thank you everybody. I am seeing that there are 52 participants. That's a very good number as far as our this organization is concerned. I thank everybody, all the audience, and also the Praveen. And if there is any questions from anybody, or if there is any additions, it is most welcome.
May I say something? Couple of new news, because we have been working here, and now government is changing the policy that not everybody who doesn't have symptom gets PCR test done free of charge. So from yesterday, I think now couple of private hospitals have also been allowed to do PCR. You know, Star is the one. I think BNB started, Pravin?
Not
doing
yet.
PCR?
PNB has been trying. I heard that BNB has invested huge amount of money. It cost around 1 crore. Constructing the whole room, manpower, machine, everything. So BNB has already started, and probably very soon BNB will also be allowed to start PCR.
Okay.
But not yet.
Because now, right now we've been doing PCR before surgery as a pre-op, and then if PCR becomes positive, we operate in the COVID block. If PCR comes negative, we operate in the usual block. Now what government is saying is we cannot just order PCR test as pre-op if the patient is not symptomatic. So we had a meeting yesterday in teaching hospital that, we as neurosurgeon have the right to send the test, but if the patient is not symptomatic, then government will not pay, but patient has to pay, and it will be around 6,000 rupees. So that is the new information I want to share. But everybody wants to have a peace of mind and want to get the test done before the surgery. Not only you, it is the anesthesiologist, it's the OR nurses, because for them also sometimes you have to do the test, and then now the government is not covering that test cost.
I fully agree with you, Mohan. We must get PCR done pre-operatively because it has already happened in our part of the world, and the doctors are being blamed and the journalists are unnecessarily blaming. So we must get it done. Whatever cost is there, that is immaterial.
Yes.
For our safety also and team safety also.
Yeah.
Krishna sir, any remarks? Krishna sir? We can't hear you, sir.
Unmute garam, sir. Unmute garam.
The timing, I would like to thank Intas and Professor Amit as well for helping us to conduct these webinars as well. We will have a photo session.
Okay. Thank you, Prabin sir. Thank you, Dr. Praveen. Thank you, Suraj, for coordinating it. So since you all know that this particular webinar is being facilitated by Nepal Medical Council, so as their demand, we have to put forward the number of policy participants. May I request you again to please type your NC number if you have not done yet. Those who have already typed earlier need not to, because you already note down all the details. The second part is a small post-test basically, and a feedback form, so which we have managed to do this time on menti.com. So if you can see this slide, there is a web code, or you can even scan the QR code on your mobile device, and it will directly take you to the website. So I have not yet started the Menti questionnaire, so you won't see the question coming up, but then you can still go to the website. It